Good morning, folks. Welcome to the PT on Ice Daily Show. My name is Dustin Jones, and today we're going to be talking about clinical tips to bring wearables into your plans of care. Wearables, when I say wearable, I'm talking Fitbits, Apple Watches, Whoops, iPhones, whatever, right? Something that's going to be able that they're going to wear and then be able to track some really valuable data. First, I'm going to cover some really interesting research in a new study that showed the power of implementing wearables in our courses of care, and then just some things to think about as we try to add these in and bake these into our sessions, our conversations, because especially when it comes to geriatrics, there's a lot of implications here. So first, the data of what we can achieve with some of these things. So I want to cover a recent publication. It's a randomized controlled trial that it's relatively small, but I think it's pretty profound. They implemented wearables in alongside a cardiac rehabilitation program. So it was around 39 individuals, around the average age of 73, was admitted into cardiac rehab. For those that are not familiar with cardiac rehab, usually someone's had some type of cardiovascular event like an MI, myocardial infarction, or heart attack, and they are in this cardiac rehab program. Usually it's 3 times a week for 12 weeks, supervised exercise. They're monitored and their dose supposed to be a dose appropriately based on their vital signs, which if you've spent any time around cardiac rehab, that doesn't always happen. A lot of people can end up being underdosed in that realm. So all these people were in this cardiac rehab program. They gave half the group a wearable, which in this study they used a Fitbit. It was around $170 is what this cost retail. So I'm not sure how they paid for this. If the facility gave them to those, I'm not sure. It didn't disclose, but they were using that device. And so they were given a target of 30 minutes of moderate intensity activity per day, trying to get to those physical activity guidelines, knowing that people likely weren't going to get 30 minutes per day, or they were told to give 15 minutes a day of vigorous activity. And they showed them what that meant from the RPE standpoint, and they gave them a heart rate threshold to hit as well, because the Fitbit can show that pretty easily. So those were the recommendations. They just told them that, which I think for all of us, if we tell our patients that, I'm not necessarily optimistic that they're going to go and do that thing, right? But what they did is they had weekly check-ins, and this is a kicker. They had a device that measured it, and they had weekly check-ins to review how they did. And over the course of the 12 weeks, and this is where it gets kind of crazy, is the folks that had a wearable on average increased their physical activity by around 2,000 met minutes per week. Now, that for me, I think is very arbitrary. It may be for you too. Like, what in the world does that mean? If you were to equate that to steps was not an outcome, by the way, for this study. It was just looking at overall physical activity and met minutes per week. But 2,000 met minutes per week is going to equate to roughly an additional 8,500 steps per day. And I don't know who here, Carrie, Philip, Bethany, Lisa, if you all track your own steps, right, that are watching this live, but that's a significant amount. Many of us may have step count goals. The most arbitrary one is 10,000 steps per day, which is not easy to get. And these folks increased by the equivalent of 8,500 steps per day. That is a lot. Now, when you take that information and also understand the impact of the increase of step count, for example. So I covered this on a previous podcast. So there was a Lancet article, 2025, that came out that looked at some of the risk of all-cause mortality when we look at the increase of different step count goals. And what they were able to find, Philip, all day, every day, he's tracking steps. So if you have 2,000 steps per day, you're averaging that, and you bump that up to 4,000 steps per day, you're going to have a 25% reduction in all-cause mortality. Pretty significant. If you go from 2,000 to 7,000 steps per day, that is a 47% decreased risk from all-cause mortality from all causes, all diagnoses. And then if you get up to 10,000, 2,000 to 10,000, that's going to be a 53% reduction. What those numbers are really portraying for us as rehab clinicians is even the 2,000 to 4,000 jump is huge. The 2,000 to 7,000 step jump is massive. from the compared to 7,000 to 10,000, it's relatively marginal. So we start to see a leveling off of impact beyond kind of that 7K range. So I think this data points that for us, in working with individuals that likely have relatively low step counts, giving them a 10,000 step count goal may be very unfeasible for that individual, and you may be getting marginal impact to beyond like 7,000, for example. So this shows the value of some of those smaller goals. So for me, it's like, man, if I'm working with a relatively sedentary, physically inactive individual, I'm not going to throw out 10,000 as the goal. That's going to be very hard for them to get. 7,000 is going to be much more achievable, even 4,000, right? These like smaller goals are very meaningful. The overarching theme is that every step counts, especially when someone is sedentary and physically inactive. So if we go back to this cardiac rehab study, that they on per day increase on average, right, the equivalent of 8,500 steps per day, massive implications for their overall health. And all they did was add in a wearable and then had some check-ins and got these results. They also looked at VO2 max. They also looked at their anaerobic threshold and then their 6-minute walk test as well. Those all improved. But the one that really caught my eye was the overall physical activity, the MET minutes per week. Okay, that's interesting. Now let's talk about what does that mean for us, all right, working with individuals. So I think the first thing is to start to gauge physical activity and assess physical activity, whether it's subjective or objective. The vast majority of folks that I'm working with nowadays, I don't know about y'all, but I'm in the context of outpatient orthopedics, working with older adults, and a gym. It's called Hyphen. And most of the people that I work with either wear an Apple Watch or some type of smartwatch, or they have a smartphone that they have on them a lot of times throughout the day. Both of those things are actively measuring their movement. I mean, Apple Health, for example, if you look at the Apple Health app, many clinicians aren't aware of this. It's looking at your gait deviation, your average gait speed, how many stairs you take per day. I mean, tons of metrics, but it's also measuring that step count. We can get a baseline assessment already and get a good idea of where people are and kind of surface that because some people may not even be looking at that. So I think it's a really great place to start. Look at, are there wearables that they're already using? If they are using it, then let's build that into the plan of care, into the home exercise program, giving them very approachable goals. So if I look at someone's phone, pull up their Apple Health app, I'm going to say, all right, I think it would be a really great idea to start to measure this and start to hit certain goals. What do you think about that? Have you heard much about step count? And inevitably, yes, I did see that article that said 10,000 steps per day. It was so good for you, blah, 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 blah. Right. Okay, cool. Well, I'm going to take this app and I'm going to add it as a widget on your front page, for example. Would that be okay? Yeah, that'd be awesome because you have 1,700 apps and you're not going to know, you're not going to check this. So adjust it so they're going to be able to see it or maybe even adjust their notifications. I like to add a widget, meaning kind of that bar that you can put on their homepage that they can look at. You don't want to disrupt maybe their current flow and current apps that they're using, but that can be very helpful to surface that information. And then yes, Lisa, I'll drop their open access. I'll drop the PDFs on the comments when I'm done. Lisa asked about dropping the studies. So I get a baseline assessment. I'm going to make it easy for them to get that short feedback loop by adding a widget, something along those lines, or adding a notification. And I'm going to give a very manageable goal. So if I have someone that's averaging 1,500 steps per day, I'm going to go to 2,000. I'm not going to go to 7,000, right? That's where I want to end up, right? But I'm not going to do that day one. It's the same thing as when we're trying to get to high intensity resistance training. Betty is not going to be all about doing 5 sets of 5 reps, 80% of their 1 RM the second day that you see her, right? You're going to gradually build up to that. Same with these step count goals. And you're going to get an impact. So I'm going to get some successful reps at 2,000 steps per day. And then we're going to continually add that or bump that up. And if I'm able to get a weekly check in and see that you're able to get some success, then boom, you're going to reinforce that and be able to adjust those goals. One thing that is important though is to preface that not every day we're going to hit that goal, right? I mean, y'all know Philip, right? Like, Philip, you probably have some good days and some relatively low physical activity days, right? You may not hit your goal every day. At least that's the case for me. We also don't want to lay down the expectation for our patients that you should hit that goal every single day, because that's probably not going to happen initially out the gate. So make it okay that they, have a lower physical activity day. That's fine. But we get back on the horse and we try and shoot for that. Maybe say, hey, over the next week, I want you to hit 3 days of that 10,000 step count goal. Something along those lines. Make it very approachable, get some wins, and then progress it from there. With that being said, we do want to try and get, if we can, get to that 7,000 step goal. That is very, very significant. 47% reduction, reduce all cause mortality, right? That is going to be huge for their overall health and associated with other health outcomes, right? Philip says, I do like a weekly threshold. Look at the whole week versus a days. That's a really good point. And you can show people how to adjust that data to where it shows weekly versus daily. That's a really good point, Philip. So that mechanism right there of making it easy for them to see it, we're shortening that feedback loop, which is the beauty of a daily step count or weekly step count for that matter, is the feedback loop is relatively short compared to the feedback loop of them getting blood labs drawn and waiting 6 months or 12 months to see the difference in their cholesterol, right? We can do that on a daily basis of they put in the effort, they see the results. Short feedback loops can be very helpful. We build in the accountability and the check-in. Whatever weekly is a great one to start with. Or if you're seeing them more often, 2 times a week, that would be awesome as well. And see reports and then be able to adjust those goals. I do want to take the time to highlight some different apps that make this, I think, more approachable or achievable virtually. So Step Up is an app that we love to use here at Ice Physio. It's a free app, and you can create different groups. So you could do a clinic group, for example. We have one for Ice Physio. I'll drop that in the comments of this video if you all want to join. A daily, basically, competition to hold each other accountable. You can set goals. You can see weeks. You can see months, trends very easily in there. Also has a messaging capacity, which could be really bad, but I believe you can adjust that as well. But that could be a way to check in on someone that they could share their step count goal with you through that app. And the beautiful thing about that app is it can integrate with all kinds of different wearables. I found that sharing your data, if someone has like an Apple Watch, can be cumbersome, and there's limits to how many people you can share that data to. The Step Up app kind of goes around that barrier and can make it a little more feasible for folks. So that's what I want y'all to think about. Step count, building it into your plan of care, right? No one's going to come to physical therapy for their step count per se, probably back pain, shoulder pain. They're worried about their balance, but we can kind of bake this in to increase their physical activity levels. That's going to influence so many different outcomes. And even if we make a small jump, you're going to have a substantial impact in their health. We can do that by making it easy for them to track using a device they may already have, surfacing that data so the feedback loop is super, super short, building in those check ins to be able to hold them accountable and maybe adjust those goals as well. And you can take it a whole nother step and make it more of a communal competition situation with something like the Step Up app. For me, I will speak personally, building in the accountability and community piece that the Step Up app has done for me. I increased over the past year my average step count per day by 3,000 steps just by adding that alone. A lot of incentive to do that. On the daily, I'm trying to beat Alan Fredendahl. I'm trying to absolutely destroy that man, but he ends up killing all of us with ungodly step counts per day, but I'm always chasing him. And that's been helpful for me from the health standpoint. So I will drop the links to these studies in the comments. I'll drop up the Ice Physio Step Up link as well. And if y'all have anything else to add, if you're using step count, talking about physical activity, drop it in the comments. I'd love to hear some ideas and things that have worked really well for y'all. With that being said, I want to mention one course that we have coming up, Older Adult Division. We have our certification. The entry level point of our certification is going to be our Older Adult Level 1 course, 8-week online cohort to give you the fundamental skills to change lives in this population, to be the go-to provider in your community. That next cohort is going to be starting on May 20th. After that cohort, we take a long break until late fall. We would love for y'all to join May 20th, level one. Y'all have a lovely rest of your day. Check out those links, and I'll talk to you soon.